Question 1. Legionella pneumophila, BCY agar, and pneumonia. A 63-year-old man with a history of smoking presents with high fever, diarrhea, confusion, and dry cough. Chest x-ray shows patchy infiltrates. Routine sputum culture is negative. Special culture media with cysteine and iron is required to grow the organism. What is the most appropriate treatment? A. Amoxicillin, B. Azithromycin, C. Metronidazole, D. Nitrofurantoin, E. Vancomycin. Correct answer, B. Azithromycin. Why? Legionella pneumophila causes atypical pneumonia with GI and CNS symptoms. It grows on BCY agar, not standard media. Treatment includes macrolides, e.g. azithromycin or fluoroquinolones. A. D. Ineffective. C. Used for anaerobes protozoa. E. Targets gram-positive bacteria. Question 2. Brucella, occupational exposure. A 35-year-old veterinarian presents with undulating fever, night sweats, and arthralgia. Blood cultures require cysteine-enriched media for organism growth. Which of the following exposures most likely led to the infection? A. Inhalation of bird droppings. B. Consumption of unpasteurized milk. C. Bite from a stray dog. D. Contact with infected rodent urine. E. Swimming in contaminated freshwater. Correct answer? Consumption of unpasteurized milk. Why? Brucella is transmitted via unpasteurized dairy or contact with livestock. It causes undulating fever and needs BCY agar with cysteine and iron. A suggests histoplasma. C suggests Pasteurella. D suggests Leptospira. E suggests schistosoma. Question 3. Francisella tularensis, bioterrorism and ulceral glandular disease. A 40-year-old hunter develops a papule on his hand after skinning a rabbit. The papule becomes an ulcer, and he develops fever and tender axillary lymphadenopathy. The organism requires cysteine supplementation for growth. Which of the following is the most appropriate initial antibiotic? A. Gentamicin, B. Ceftriaxone, C. Azithromycin, D. Doxycycline, E. Penicillin. Correct answer. A. Gentamicin. Why? Francisella tularensis causes ulceroglandular tularemia. It requires cysteine for growth, BCYE agar, and is treated with aminoglycosides like gentamicin. Doxycycline is an alternative, but gentamicin is first line, B, C, E, not effective. Question 4. Pasteurella multicida, animal bite. A 27-year-old woman presents with cellulitis and pain in her hand 12 hours after being bitten by her cat. Gram-negative coccobacilli are isolated. Which of the following is the best initial treatment? A. Vancomycin, B. Azithromycin, C. Cefazolin, D. Amoxicillin clavulinate, E. TMP-SMX. Correct answer, D. Amoxicillin clavulinate. Pasteurella multicida, transmitted via cat or dog bites, can cause rapid onset cellulitis. It grows on enriched media like BCYE with cysteine and is treated with amoxicillin clavulinate. A. C. Don't cover Pasteurella well. B. Not first line. E. Often ineffective for bite infections.